Approximately 24 million people in Pakistan require mental health care, but at 90% do not receive any form of treatment due to factors like stigma, lack of awareness, and limited access to the services. Out of them, depression, anxiety, and schizophrenia are among the most prevalent mental health conditions in Pakistan. And I hope you all are familiar with these three terms and are being seen mostly within the patients in Pakistan. A study conducted by Gallup Pakistan and Win World Survey found that 13.6% of Pakistanis express concern about their mental health and stress. Then another survey that was done, a survey of college students, revealed that a large percentage experienced moderate to severe psychological distress, with anxiety and depression being prevalent. The National Psychiatric Morbidity Survey (NPMS) in 2022 projected a weighted lifetime prevalence of 37.91% for various psychiatric morbidities and a current prevalence of 32.28%. So you can see the stigmas are there. Why is that so? That people do know about their psychiatric or psychological or emotional concerns, but they don't turn up to the therapists or psychologists or psychiatrists because of the social stigma, as if they're gonna go and visit the clinics, and if somebody can be seen by some relative or related member of his family or from his social setup, he may be labeled as a psychiatric person or mental or abnormal person. So this is the basic social stigma that is being not seen only in Pakistan, but all over the world. Due to which, if you can see, World Health Organization, the latest guidelines of 2025, they say that the need for action on mental health is urgent and indisputable. Because mental health, why is that so? Why they are so much concerned about the well-being of people mentally, or the stability of as far as our mental health is concerned, is very important, because it enables people to cope with stresses, challenges, and realize their abilities and work well, and also to contribute to the community and the family. So mental health is not only that is restricted to your family or to yourself, but whatever you are, you've been, you can say, an effective member as far as your social setup is concerned, your environment is concerned, where you work, or your peer relationship, your family relationship. It all depends how you behave, how you think, how you act. So mental health governs how you, as I've said, that how you feel, think, and act. Because whatever you feel, definitely it has a connection with your thought process. And whatever your thought process, whether it is negative, whether it is positive, it will affect your behavior, the way of communication, the way of your lifestyle you are living in, your stability, your mental health state, your mental health stability, and your state of mind. They play a very important role uh, to present you as a person, to present you as a personality. So that's why it's been a hot topic all over the world, and a lot of workshops and seminars and webinars are being done on this specific topic. So the important thing is to develop coping mechanism, how to manage your mental well-being. What are the key factors that can be, you can say, play an important role in making your mental state the stable one? First of all, to identify the triggers that can be the big stressors that can be the cause of your um, unhealthy mental well-being. Secondly, the most important thing is to practice self-talk that should be a positive one. We are into the habits, or we are habitual of talking in a negative way. Always we talk about negative first, and then if somebody is there, a good advisor or a good counselor in your family or in your friends or in your maybe his your therapist or a good counselor, they will always direct you towards positivity. They will let you know how to be positive, how you switching your negative thoughts to the positive ones. But we, being as a nation, we are habitual of first towards negativity, and if with the luck you found a good person whom you can trust, will guide you towards the positivity nature of um, your positivity track. So, identifying triggers, practicing yourself a self-talk that should be a positive one, setting up realistic goals. In this modernized world, we are so much busy with our ambitions that we forget that what are the goals that could be reachable and that aren't be reachable. So, setting up the realistic goals will enable you to get a sense of achievement. But setting up unrealistic goals definitely provoke dissatisfaction among yourself within yourself. Because when you are not able to achieve your goal, there may be or there might be a sense of loss, sense of worthlessness, and sense of losing or hopelessness could be there. So setting up the realistic goals is very important in your life. This you can say this is a key towards your success if you set the realistic goals according to your abilities, according to your capabilities. Plus, one of the most important coping mechanism is seek support when needed. What we do is that we don't talk. We try to solve our problems, try to solve our problems ourselves. We base our most of the knowledge on assumptions. We don't try to go along with logic. Whatever the situation may be at home, maybe at your workplaces, we don't talk, we don't ask, and keep on fighting within ourselves. Other than that, that we should must bring into an account with those people whom the problem is provoking with. And I have seen many people, even I work in a hospital, I see people coming to me. He said this, she said this. They keep on coming to me, but they don't go to the specific person with whom they have a problem. So if we don't talk to the ones who are creating the problems, we are not able to reach out the solutions. Also, reaching out the solutions, you need to diagnose the exact problem, the root cause of the problem. the root cause that is provoking the problem, and that root cause sometimes you can be yourself, sometimes somebody else, or sometimes your assumptions that don't have anything to do with the realistic life. So that's why it's very important to seek support when needed, to talk when needed. And this is the positive way that you can counsel yourself, that you can um, try to find out the solutions. Once you are on the track of finding out the solutions, you will be able to reach out a better way out from your problems. So these are the four best ways, best recommendations that can be used as a coping mechanism, that identifying the triggers, practicing positive self-talk, set realistic goals, and seek support when it's been needed. And support is not only necessary that you should book an appointment with a psychiatrist or a psychologist. It can be anyone whom you can trust. But if you think that there needs a professional help, then you must seek a professional help from your therapist, or if there is a problem, is a big one that is related to neurotic issues, then you can definitely go for a psychiatric help. But I believe that if um, at the start of your problems, you can get engaged with someone, a good counselor, a good psychologist, if needed, then you may not find any need to be on getting on to psychiatric medications. So this is
Miss
important.
Kiran,
Yes.
sorry to interrupt you, but we're running out of time a little bit.
Okay, I'm
So,
just putting it up. So last of
thank you,
all,
Miss.
the physical health is very important. It's regular exercises and sufficient sleep. These two are very, very important that we all, I must say that we all ignore this when the things come to our personal, personal well-being. So, mental health and physical health are related to each other and closely linked to each other. If your mental health is stable, your physical health will work very well. But same goes for the physical health, that if your physical health is fine, it's up to the mark. You will not be feeling sad. You will not be feeling depressed. You will not be feeling that from where I'm going to pay my medicines, where I'm going to pay for my tests. So these both mental and physical health are interrelated with each other. So thank you, Neha, for this opportunity. I hope in this short time I may have conveyed my message, that the foremost, like almost the most important thing of all is the stability as far as your mental state is concerned. Thank you.
Thank you, Ma'am Kiran. Now, the host Naima, which is our today's session's moderator, so she will handle further speakers. Thank you.
Thank you, Miss Neha, and thank you, Miss Kiran, for those wise words. Now, moving forward, I would like to welcome Dr. Madiha Ilyas, HOD Nutritional Sciences at GC Women University, a highly respected educator and expert in nutrition. We're truly honored to have you with us, Dr. Madiha. Please contribute your expert knowledge on the topic.
Thank you very much, Naima. I want to share my PPT. Can I?
Yes, Miss. I think you're allowed to share your PPT. Or else I'd like the host, Science International, to allow you.
Okay, thank you very much. First of all, I would like to extend my gratitude to the organizers for the invitation, and special thanks to Dr. Ataur Rahman for leading this impactful series of health awareness seminars. Thank you, Dr. Saab. Your efforts are highly commendable. So I truly honored to be a part of this seminar on a very important topic, which is mental health. So I would like to share my thoughts on the role of nutrition in mental health. Am I audible?
Yes, Miss, you are.
Yes, ma'am. Okay. So, as we all know that diet and nutrition in mental health or nutritional psychiatry refers to as psychonutrition. It is a, new field of study that focuses on the effect of diet on mental health. So, recent researches has shown that various foods and supplements helps to improve people's mood, relieve anxiety and depression, and improve the mental capacity of the people. So, the food we eat is associated with our cognition, behavior, and mood, and that food plays a very important role in the management and prevention of mental health problems, such as depression, anxiety, mood disorders, and Alzheimer disease. So, there is a close relationship between diet and mental health. Mood can influence eating habits, and in turn, it can impact our psychological well-being. So, people tends to eat too much or too little when they are stressed or depressed. So, negative emotions such as anger, fear, and sadness, they are also associated with irregular eating patterns and eating as a distraction to relax and feel better. So, stress mostly associated with the cravings of high fat and high carbs diet. Like you can see it, how mood affect negative and positive mood affect the eating pattern. Then, similarly, the brain also has a direct effect on the stomach and intestine. So, for example, every thought of eating can release the stomach's juices before food gets their connection, and it goes both way as well. So, a troubled intestine can send signals to the brain, just as troubled brain can also send signals to the gut. So, prolonged mood disturbance can disrupt the digestive system and cause several GIT disorders like diarrhea, constipations, cramping, bloating, or it may also lead to peptic ulcer, IBS, and further other diseases linked to GI tract. So, diet play a vital role in the brain health or mental health, you can say. Diet, especially diet containing ample amount of protein, it is associated with several mental health boosting benefits, including it is a production of serotonin, which is a free good chemical in the brain. It reduced the cortisol level or stress hormone in the body, and it improved mental clarity. It is made from the essential amino acid tryptophan, and this amino acid must enter your body through diet, and it is commonly found in the foods such as nuts, cheese, red meat, seeds, etc. So, tryptophan deficiency can lead to lower serotonin levels, and this can result in mood disorders such as anxiety and depression. So, serotonin is a chemical that has a wide variety of functions in the human body. It is sometimes called happy chemical because it contributes to the well-being and happiness. And when we talk about carbohydrates, there is a direct connection between carbohydrates and the brain. So carbs break down into glucose, which is preferred form of energy for the brain. And glucose also supports the brain's overall functioning. As you know, glucose is the sole source of energy for the brain. So one can consume complex carbohydrates instead of simple carbohydrates because complex carbohydrates are rich in fiber and they also support a gut health as well. So having a healthy gut directly correlate with our mental health as 95% serotonin is produced in the gut. So pair it with pair carbohydrates with proteins and fats to stable the blood glucose level. Like fiber, proteins, and fats helps to slow down the digestion of carbs and their absorption into the blood. So it helps to prevent the spike in the blood glucose after eating. So take carbs with the best combination of fats and proteins and fiber as well. Then, when we talk about antioxidants or vitamins, especially those are antioxidant vitamins like vitamin A, vitamin E, and vitamin C. So they are helpful in the protection of the nerve cells from damage and improve neurotransmitter functions, which can help to prevent and manage depression. So it is suggested to include plenty of fruits and vegetables in the diet, as high intake of fruits and vegetables leads to lower level of biomarkers of oxidative stress and better cognitive performance. Especially green leafy vegetables, they are rich in brain healthy nutrients like vitamin K, folate, beta carotene, etc. Then B vitamins also play a vital role in the brain health by supporting energy production for brain cells, and they are also helpful in the synthesis of neurotransmitters, contributing to overall cognitive functions and mental well-being. Also include calcium and magnesium in the diet. They are also associated with the anxiety and stress relief. Potassium also play a vital role in modulating depression status of the body. And then when we talk about fats, take healthy fats. They have direct effect on the production and supply of energy to the brain. And choose healthy fats like fatty acids, omega-3 and omega-6. They are essential for our brain to function well. Omega-3 associated with depression, reduction of depression and bipolar disorders. And they are present in rich amount in flaxseed, nuts, walnuts, almonds, and fish as well. Then these are a few tips to consider for the reduction of anxiety and stress, like avoid junk foods and fixed meals, quit smoking and avoid alcohol. It reduces stress, avoid excessive intake of caffeine consumption, and drink plenty of water and plenty of water and milk. It helps to it helps to make a body stress free and you feel relaxed, and also maintain healthy weight in order to avoid different nutritional disorders. All disorders are ultimately linked to stress and depression. And then avoid foods that trigger the stress, which are artificial sweeteners, fat-free products, processed cheese, carbonated drinks as well. And then choose healthy swaps. Instead of French fries, you can use fresh vegetables. And instead of different desserts or confectionaries, you can choose fruit yogurt. And instead of coffee, you can take turmeric milk or golden milk. And further do regular exercise and do meditation as well.